Understood.
Okay, today I will describe one of the most important issue of the world, the global problem that that is the one of the viral disease which cause the ravage and the havoc in the world, and the world was collapsed. Every country, each country was isolated from another country, and every person was contained in their houses, and that is the topic, that is the infection, viral infection. In the current situation, the infection is called the coronavirus disease 19. Coronavirus disease 19, because by the end of the 19, the first case emerged in the Wuhan city of the China. So this disease was named as a coronavirus disease 19. Although the most of the cases occurred in 2020, however, it is named as coronavirus disease 19. There is a group of the viruses which is known as the coronaviruses. And this contains the three types of the viruses. The most earliest virus, that was the coronavirus, the SARS coronavirus 1. And then emerged the MERS coronavirus. And the third one, which was the novel coronavirus 2019, the Chinese researchers named it the novel coronavirus 2019. However, this virus was renamed as SARS coronavirus 2. And the disease caused by the SARS coronavirus 2, the WHO named the disease which is caused by the SARS coronavirus 2 is the COVID-19. So the WHO in the 2020 named the disease coronavirus disease 2019. So this is one of the burning topic, and the coronavirus includes, this group includes the three viruses. The earliest one is the SARS coronavirus 1, and then the MERS coronavirus, and the third one is the SARS coronavirus 2. Regarding the SARS coronavirus 1, this virus was isolated in the 2003, and this involved about approximately to 29 countries, and the mortality rate was the 774. And the next virus, the coronavirus, is the MERS coronavirus, which was identified in 2012, and this involved the 27 countries, and the death toll was the 861. The third one is the novel coronavirus 19, which is also known as the SARS coronavirus 2. And by the end of the December 2019, in the city of the Wuhan, the province of the Chinese, that is the Hubei. So by the end of the December 2019, this virus emerged, and almost every country of the world was involved. No one was exempted. Almost every country was involved. So the death rate, the mortality rate, or the deaths occurred in or the 5,60,000. So it has a high mortality rate. 5,60,000 the deaths has acquired since that time up to the till to date. The most severely affected countries are the USA, Italy, and Spain. So the USA, Italy, Spain, these are the most severely affected countries. Now the names, the acronyms for the SARS, MERS, and the COVID. The SARS is the acronym for the Severe Acute Respiratory Syndrome. The MERS is the acronym for the Middle East Respiratory Syndrome. And the COVID is the acronym for the coronavirus disease. So it is important to understand these acronyms, the SARS, the MERS, the COVID. Now coming to the morphology of the SARS coronavirus 2. This belongs to the coronaviridae family, and this one is the singly stranded RNA virus, and it is enveloped. It contains the different structured proteins, and these are the spike proteins, S proteins, the M proteins, that is the matrix, and the E proteins for E for the envelope, and the N proteins, N for the nucleocapsid. So these are the different antigens, different proteins present in the structure of the SARS coronavirus 2. The host range of the coronavirus 2, the initial host, which are recognized, are the bats, birds, and rats. So the initial host are these bats, birds, and rats. As the first case, the initial case emerged from the people which were engaged in the seafood markets in the Chinese city of Wuhan. So this indicates the animal origin of this virus. The SARS coronavirus and MERS coronavirus, they are in fact, the reservoir is in fact the bats. The bats are the natural reservoirs for both of these, the SARS coronavirus and the MERS coronavirus. The bats are the natural reservoirs. So these are the definite hosts. And for the SARS coronavirus, the intermediate host is the cats, which are the civet cats. The MERS coronavirus, in case of the MERS coronavirus, the intermediate host are the camels. And this MERS coronavirus cases occurred in the Middle East in the camels. So the intermediate host are the camels. So that is the host range of the coronavirus SARS-2. How the COVID-19 is transmitted. The modes of the transmission, one of the most of the important mode of transmission is the human to human, and the animal to human transmission is also suspected. So the human to human transmission is well recognized, and the animal to human transmission is also involved. So these are the two modes of transmission. In case of the human to human transmission, the respiratory droplets, they are which contains the the viral infection, the viral genome, and that is transmitted in the respiratory droplets from the human to human, and by the sneezing, coughing, and laughing. These droplets are transmitted from one person to another person. The direct contact with infected person, hand-to-hand contact, in contact to the contaminated surfaces. This one is the direct contact, hand-to-hand contact, and contact to the contaminated surfaces. This is the one of the mode of transmission of the COVID-19 SARS coronavirus 2. The aerosols in the closed spaces, they are also implicated. They are also one of the source of the viral infection, the SARS coronavirus 2. So the respiratory droplets, the direct contact, and the aerosols, these are responsible for transmitting the coronavirus 2 from one person to another person. The pathogenesis of the how and when the disease is caused. The coronavirus enters into the lower respiratory tract epithelium, and this virus binds to the SCE, the angiotensin converting enzyme receptors, which are present in the surfaces, the alveoli of the lungs, and this leads to the production of the cytokines. So the cytokine storm is produced, and this leads to the lung injury, and this lung injury is the one of the disease, that is the viral pneumonia. So lung injury that causes the pneumonia, and that is the viral pneumonia. So this is the pathogenesis, how the coronavirus 2 enters into the alveoli, and then how it causes the viral pneumonia. You must remember that the receptors for the coronavirus 2 are the angiotensin converting enzyme receptors, which are present on the surfaces, the alveolar surfaces, and this leads to the huge production of the cytokines. And when the huge production of cytokines occurs, the inflammatory agents, the inflammatory cells, they are accumulated, and they cause the lung injury, and this lung injury in the form of the pneumonia. It is in the form of the pneumonia, and that is the viral pneumonia. The symptoms of the COVID-19, the most common symptoms are the fever. The 98%, the most common symptom is the fever, and that is the weakness, generalized weakness, dry cough, the sore throat, and the diarrhea. So these are the most common symptoms which occur in the infection by the coronavirus, SARS coronavirus 2 in the COVID-19. So these are the most common symptoms. Clinically, the coronavirus COVID-19 represents in the different forms according to the severity. It presents itself as a different forms clinically. On the basis of the severity, it may be the mild disease, moderate disease, the severe, or the critical. So the symptoms in most of the cases, the disease is the mild, and in 81% approximately, it is mild disease. And the symptoms are the dry cough, mild fever, the nasal congestion, the flu-like symptoms. These are the flu-like symptoms, the sore throat, headache, muscle pain, and malaise. So these are the symptoms of the upper respiratory tract, and they are the flu-like symptoms. And this mild disease is characterized by the absence of the disease. And the radiographic changes, changes are absent. So this is characterized by the absence of the dyspnea, and the radiograph findings are absent. However, this can quickly convert, quickly deteriorate the condition. It transforms into the severe or the critical case. So this mild disease, the mild form of the COVID-19, is characterized by the absence of the dyspnea, and the radiograph findings are absent. However, the symptoms of the flu-like symptoms, and these flu-like symptoms which are present. A severe form of the disease of the COVID-19, it is characterized by the severe pneumonia, and that severe pneumonia, and the second is acute respiratory distress syndrome, ARDS. So, and third one is the sepsis or the septic shock. So the severe form of the disease is characterized by these three severe pneumonia, acute respiratory distress syndrome, sepsis or the septic shock, and the clinical presentation is in the form of, it is characterized by the severe dyspnea. The tachypnea, the respiratory rate is raised, and the respiratory distress and the lung infiltrates are present within the 24 to 48 hours. So these are the clinical presentations: severe dyspnea, the tachypnea, the respiratory distress, which is characterized by the lung infiltrates within the 24 hour to 48 hours. Regarding the diagnosis of the COVID-19, the most important investigations which are performed, one of the most important investigation is the COVID-19 real-time PCR. PCR is the most important criteria for the diagnosis of the COVID-19. PC or quantitative PCR, real-time PCR is performed, and the second way of investigation is the immunoassays by the ELISA, the antigen and the antibodies. They are detected by the ELISA, and the other serological methods are the rapid diagnostic test. And these are the three major ways of diagnosing the COVID-19: the PCR, real-time PCR, ELISA, and third one, the rapid diagnostic test by kit methods. And the additional laboratory diagnostic tools are the increased prothrombin time is assessed, the increased D dimers, they are investigated, and the LFT is performed, in which the ALT is raised, and C-reactive protein, they are also investigated, and they are increased in case of the COVID-19, and creatine kinase CK enzyme, it is also increased. However, the CD4 and CD8 lymphocytes, in the early stage, they are decreased, and the interleukins in the blood, they are increased. So these are the additional tools for the laboratory tools which are advised in order to come to the conclusion, to the diagnosis. The chest imaging is very important to see the lung opacities. So the chest imaging is very important. The chest X-ray is performed, which determines the substantial opacities in the lung parenchyma. CT scan is the most important, and this identifies the lung infection by the COVID-19, the ground glass opacity is found, the consolidation of the lungs, and the mediastinal lymphadenopathy. These are identified by the CT scan. And the third one tool, the imaging tool, is the lung ultrasound. And this can be helpful. It can be supportive in order to come to the diagnosis. So the chest X-ray, the CT scan, the lung ultrasound, these are performed. They are advised in order to diagnose the COVID-19. How the COVID-19 is managed. Usually it is supportive, the supportive treatments, the antipyretics are given for the fever in order to reduce the fever. The oxygen therapy is given because the hypoxemia occurs, and the external cooling, the nutritional supplements, they are advised. And if the secondary infection, the bacterial infection is suspected, the antibiotics, they are advised in order to inhibit the secondary infection to reduce the mortality of the bacterial infections. So these are the supportive measures. And the prevention is the self-isolation. Self-isolation is one of the most important way in order to cut off the transmission from one person to another person. And the frequent hand washing with soap water is very important. The hand sanitization and the social distance, keeping the social distance away from any suspected infected person, and the use of the mask and gloves. They are the precautionary measures, they are the preventive measures which must be implemented in order to cut off the transmission and to be safe. So these are the preventive measures. Thank you very much for listening.